built into the definition. In other words, the original people who put this together saw that this new form of record was more than just replacing the paper. It was taking advantage of the technology to assist and support decision making. They identified the 8 core functions of an EHR, or no, it's EHR, but they call them CPR in those days. One should expect that there is the decision support as a core function. They set gold standards, okay? And I haven't seen a recent analysis, but I saw an analysis, 3 or 4 years ago. Someone assessing to what extent have we achieved this. This was an American study. To what extent have we achieved it? And the 12 gold standards, I think only 4 or 5 have been achieved, even though this definition came out in 1991. Okay. A lot of our record systems, even if we have a form of electronic record, there is no problem list. There's definitely, almost for sure, nothing about health status, functional level. Very little about documenting clinical reasoning. Longitudinal time and linkage to other records, perhaps to a limited extent. Guarantees confidentiality, privacy, and audit trails that we are doing reasonably well in how to read them. Continuing access for authorized users, that's not too bad. Simultaneous views, that's not too bad. Timely access to local and remote information sources, less likely so. Facilitates clinical problem solving, a little bit. Supports direct entry by physicians, getting better. Supports practitioners in measuring and managing costs of improving quality, probably not. And flexibility to support existing and evolving needs of clinical specialists. So those were the original gold standards, which I think a lot of organizations would still like to achieve. We still have a ways to go. If you want to get a sense for sort of one approach to the structure of an electronic patient record, electronic health record, this is a useful little website, okay? Because when you click on each of those, you can then get demonstrations and see videos and things of that nature, and see explanations, okay? So this was just pointed out to me recently. It's not a guide on the website. Well, this is the vision, okay, that we're all trying to achieve. Right now, an elderly diabetic patient, or any diabetic patient with chronic diabetes, is going to touch all those areas. And in a lot of cases, each of those areas has their own records and their own systems. So there's no one comprehensive look. Okay. There are some organizations where all of those specialists and all of those elements indeed do have access to one record, regardless of where they are. Okay. And one of the organizations we'll see is Veterans Administration. Okay. Regardless of where patients are seen within their own environment, let alone within the whole country, clinicians all use the same record. So they're not independent records. But for most of us, in most parts of the world, these are all independent, separate records. So we're trying to find ways to bring those all together in some fashion. We have a spectrum, okay, of records. We have departmental data in our laboratories, in our operating rooms, in our pharmacies, where there's data at that level. At the healthcare organization level and the physician's level, we have more data. We're starting to see at the enterprise level, okay, multiple organizations within that. We're beginning to see that. And the situation now is in Vancouver Island. The next time I go into one of the hospitals, or really won't be for a while, next time I go, they will be able to access not only my previous hospital data in Victoria, but also my Nanaimo data. Now Nanaimo is integrated into the Vancouver Island health system, so we'll have access. They won't be able to access my physician's data. That's outside. And of course, they won't be able to access anything that happened to me anywhere else, but at least within Vancouver Island now, at a regional level, they've made progress. And of course, we're working on a provincial level and national level. Okay, and we'll hear more about that on Thursday. The PHR is definitely emerging. Okay? Still not mainstream by any stretch of imagination. But there's a variety of different organizations providing PHRs. Most of these examples are from American organizations. Okay? But we have Grand River, Ontario, has a nice little PHR capability. Or I think what's that clinic, doctor's office clinic complex in Ontario? Not Sault Ste. Marie. Is it Sault Ste. Marie? Sault Ste. Marie? I think they've also now developed a PHR capability, so that patients from that clinic can begin to have their own personal health records and also have them populated. So that's on that horizon. So, in closing, the journey from paper to electronic health records, okay? This is just a simple graphic that is my view, where we're at the status of paper-based records. And then we begin to see in organizations site-level records, be the site of a physician's office or electronic patient record of a hospital. And then we see that begin to move up to a regional level, more than one site. And then we start to move into the provincial arena, where we have the electronic health record or longitudinal health record of some form at a provincial level. And then we start to bring in the personal health record. And it's hard to say, but it's possible that X years from now, I have no idea where X is 10 or 20, it's possible we will only have the personal health record. That will be the record. But there's a lot of hoops to go through that before we can do that. Yep.
So I'm working on an electronic medical record for British Columbia.
Right.
And one of the emerging trends that we see is the vendors are offering what they call patient portal. So it's a technology built inside the EMR itself that the physician will adopt. We have several vendors that are offering it and will be offering it as of about steering committee to roll that out. So patient uptake will probably start to drive this. So here that this physician has it and want it from that physician, which I believe is what happened in the papers that we read. The patients actually started driving the uptake of the EMR adoption. And we know that several other vendors actually trying to also create this portal now as well. So that might be another, it's not a full patient record, it's just the GP that has the record, but it's a start. It's a little bit.
And it'll have to integrate in some fashion with the regional portals that get developed, and provincial portals that get developed.
Right now it's
Alberta's still, almost from Alberta. You're from Alberta. Okay. Do you use Netcare at all?
Yeah, I mean, Netcare is what we.
Okay, now, are you using it at the regional level or the provincial level?
It's a provincial document, so I can access it anywhere in the province. When I work in Edmonton, I access it for all the stuff in Edmonton. If there's things that are done outside of Edmonton, I can access it in that. Some screens you have to click on different buttons. There's different flow sheets that we use, that some of the things that were done elsewhere don't show up, but you can access all the buttons.
What's included? Is it lab, radiology?
Lab, radiology, you can get the pharmacy, you can get all the prescriptions.
Prescriptions for people under 65.
I think it's just over
65 and over, yeah.
I haven't signed up for that yet, but I have to fill out some paper to get that. But there's usually a resident to sign up for it on what else is there? Operative reports, consults, ECGs, X-rays.
Discharge summaries?
Discharge summaries, home care reports, community referrals. Pretty much any kind of.
So that's a provincial portal.
That's the provincial portal.
So that's different than the portal you're talking about, which is a vendor portal.
vendor portal.
Which is, would be a
Vendor
physician's office portal, more or less.
They offer patient booking, the patient can book their own appointments, they can see labs, if the physician chose to share it with them,
Yeah.
those type of things.
Now, are Alberta citizens accessing that yet?
No, I don't know about that part. I think it's just clinicians that are accessing. I remember seeing some button about patients accessing something, but I'm not accessing those patients, so I don't know.
Yeah, okay, okay. But that's a provincial portal, and I think it's, I'm not sure if Manitoba is planning the same thing. We'll have to ask Roger when it comes, but Alberta is probably our lead province in that regard, I think, by quite a bit. Robin?
Is that an integrated timeline? Or like, say, for example, are there the radiology exams from one site, another site, are they all integrated into one
Yeah.
timeline?
Yeah, it's quick radiology, and it'll give you a drop
Series
down
of
list.
tests, no matter where they're from, lab
Everything.
results, no
Yeah.
matter where they're from, it's an
Yeah,
integrated
it's
timeline.
chronological.
That's key, because BC has gone and done a radiology,
It's just, let's have only one conversation.
BC is, my understanding is BC has done a site for radiology, but they have not taken it to the point where it's an integrated timeline. So you log on as a physician and you see that the patient's had a chest x-ray here on July 8th, and then it's not put beside like it's all this, it's site specific, and that's useless for clinicians.
And that's what's going to be the interesting thing, is if BC gets an Alberta kind of portal, then what's the role of the physician's office portal? Glenn?
You can see how having a one single identifier for each particular patient would be, like, in Nova Scotia right now, we have 15 identifiers. Like radiology has their own identifier, these have their own identifier, so if you actually were a patient portal, how the system would find, oh, this is Joe Blow, X1, 6, whatever.
Well, okay, let's clarify, Glenn. I believe Nova Scotia also has a unique provincial health identifier for each patient, right?
Except that's not tagged to their
Exactly.
billing number, it's not tagged
Yeah,
to
it's
their
not used.
radiology number.
It's not used, that's right.
It's a big part.
And again, part of this, for those of you not familiar with the healthcare system, not only were the hospitals independent, so were the departments within the hospitals independent. So they set up their own numbering systems. Okay? In part because there was also not although some hospitals chose to use the hospital medical record number in radiology and everywhere else, in a lot of cases they set up other numbers.
Oh, it's a real shame, they missed that boat in Nova Scotia, because, I served a McLean in Nova Scotia, I have to go Joseph Smith McLean, or Joseph whatever, 6,000, you have to know names in order to search for people.
Yeah. Good. Okay, well, we're almost wrapped up. Yeah, okay, let's just everyone's got to keep the faith, okay? 1907, we'll start with this 1907, okay? Not easy for all the doctors to make a change. Okay? Some of the new ways seem more cumbersome, they all just a lot of unnecessary red tape. It seemed a lot simpler to jot down a few notes in a ledger lying open on a desk than to fill in little blanks on a form sheet. Much easier to pull out one's own volume out of their pocket, look up what the record was from there, and call for an envelope and wait till it was brought from the file. At first, some of the doctors just forgot about the record blanks, used their ledgers, and they were very busy, but in time they all saw the work of the new system, and the medical record has been now known today, and it became routine without further questions. Those who are introducing EHR systems in the 21st century and hope that eventually they'll have the same success. Okay, so that process, the same thing with the stethoscope when it first came out. Tremendous barrier to the stethoscope, which now it's a standard piece. So, just one final message. The EHR that we're going for is not a destination. It's a journey we're moving towards. Because I also think that we cannot predict where we're going to be 10, 15 years from now. I don't think anybody can predict where we're going to be 10, 15 years from now. I don't think very, very few people predicted where we are today 10, 15 years ago. In terms of technology and how it's affecting us and how it's impacted our lives and society, both our personal lives as well as our